one of those human beings that pees? And I'm guessing you probably are. Then you might be afraid of three little letters that seem so innocent at first, but they're not. I'm talking, of course, about the dreaded letters UTI. Ah yes, the urinary tract infection. You know what it feels like your pee is suddenly turned into boiling hot lava that's also somehow poisoned? Big time no fun. The question is, can UTIs be prevented? And is it really true that drinking cranberry juice can cure them? To answer these burning questions, I had my friends at the Cleveland Clinic gather all the facts. Let's get to it. I'm Tori, and this is the TMI Show. To know what's up with urinary tract infections, it helps to start by finding out what the urinary tract actually is. It includes some of my favorite organs, like the kidneys. They're in the back of your body, above your hips. Think of them like your body's filtration system. They remove waste and water from your blood. That waste, it turns into urine. The ureters, they're thin tubes that carry urine from your kidneys to your bladder. The bladder is the body's holding tank for urine. It's kind of like a water balloon if it was filled with pee instead of water. And finally, the urethra. This tube carries the urine from your bladder to the outside of the body. When any part of this system gets infected, that's a UTI. You might think that obviously what's in your urine is to blame, but urine typically doesn't contain bacteria, and normally it moves through the system without any contamination.
There's something wrong with your toilet.
It's bacteria that gets in from other parts of the body that typically causes problems like infection and inflammation. Most UTIs are actually caused by E. coli, a bacterium normally found in the bowel. UTIs are very common, but they happen more often to females than males. It's not fair, but it's anatomy.
I gotta take a leak first.
I've been dreading this all day, but so do I. Can I come with you and you show me how it's done?
Women's urethras are shorter than men's and closer to the anus. The urethra is also close to the vagina, which can collect bacteria during sex. So the odds, as they say, are against us. And for balance, UTIs in men are often more complicated to treat than those in women. For instance, when men have enlarged prostates, which is more common as they get older, residual urine can stay in the bladder and collect bacteria. The enlarged prostate presses on the urethra and blocks urine flow so the bladder doesn't completely empty. This increases the chances of bacterial growth that can lead to a UTI. Signs that point to a possible UTI include frequent, painful, and urgent urination. Maybe your pee is cloudy and foul-smelling too. A particularly rough infection might include pain during sex, pain in your penis, pain in your sides or lower back, fatigue, fever, vomiting, and mental confusion. A UTI can be uncomfortable before you start treatment, but once your doctor identifies the type of bacteria and prescribes the right antibiotics, your symptoms should quickly improve. It's important to keep taking your antibiotics for the entire amount of time your doctor prescribed. Don't just stop them when you start feeling better, folks. If you don't complete the full course of medication, your UTI could come back. What about drinking cranberry juice to fight UTIs? While there is an active ingredient in cranberries that can keep bacteria like E. coli from collecting on the bladder wall, most studies suggest that juice and supplements don't have enough of this ingredient to do much good. If you're a repeat UTI offender, the American Urological Association's guidelines say there's little risk in trying cranberry supplements, or you can hit the juice regularly. It may not help that much, but it couldn't hurt either.
I have a lot of bottles there.
Oh yeah, would you like a vitamin? B12? Evening primrose oil? Willow bark? Magnesium?
No, thank you.
Clinicians may offer cranberry supplements as a preventative method for recurring UTIs. Good hygiene is really job number one for preventing UTIs. Wiping from front to back is a big one. Also, make sure you pee before and after sex and avoid douching and using deodorants for vaginal odors. And opt for cotton panties because cotton is naturally breathable and absorbent. It can help you avoid both UTIs and yeast infections, a twofer. Plus, make sure you're fully emptying the tank, so to speak, when you pee. Now, this is important particularly for older adults who tend to have retention problems. Some doctors recommend double voiding. In layman's terms, that means peeing and then going back to pee again. Has this episode been as pee-lightful for you as it was for me? Got any TMI questions about the urinary tract or heck, any of the body's tracts? Drop them below and make sure to keep an eye out for the next episode of the TMI Show. Thanks for watching.